Hello there, lovely to meet you. Can you confirm for me your first and last name, please? Okay, wonderful. We do have a match. That's a good start. Okay, my name is Dr. Sean, and I'll be conducting your cranial nerve exam today. Okay, I'm going to run you through each of the steps. Okay, so there's absolutely nothing to worry about. You're in very good hands. Okay, so take a deep breath with me. And relax as much as possible. Okay, this will take around 20 minutes. Alright, and I'll talk you through each step of the way. Okay, so there's absolutely nothing to worry about. Alright, so I'm going to go through a few details here. We're going to start with the cranial nerve 12, okay, which involves the tongue. So just a very quick check. Okay, if you could open your mouth for me and stick your tongue out. There we go. And can you move it to the left and to the right, please? Okay, put your tongue back in your mouth. Alright, good. Okay, I'm going to be pressing against your cheek. I want you to poke your tongue into your cheek like so and against my hand, okay? So I'm going to start on your left side, okay? So tongue in cheek, press against the hand, as much as you can. There we go, very good. And we can do this on the other side, okay? So press against the cheek and against my hand, and there we go. Well done. Okay, so I'm going to make a few notes as we go, just to tell the department how we are doing. Alright, so that's fine, no problems there. Okay, so accessory nerve now, or cranial nerve number 11 is what we're going to do next. Okay, so I want you to shrug your shoulders for me. Okay, and relax. And now I want you to shrug your shoulders again, and I'm going to be attempting to push down your shoulders. I want you to resist, so keep them up by your ears, okay? So shrug your shoulders for me, keep them there, resist, resist, resist. Well done, relax, okay. Off to a fine start, alright, excellent. Okay, so cranial nerves 9 and 10. So I want you to, in your own time, to swallow for me. Okay, and if you can give me a quick cough, please. Now I want you to open your mouth for me, nice and wide, but not too wide that it's causing you discomfort. Okay, I want you to say ah. Checking out the tonsil region, that looks fine, symmetrical, and relax, okay? Good. Okay, so cranial nerve number 8 for this one. Okay, this will be a hearing test. Okay, I'm going to be using a tuning fork in a moment, but first of all I want to whisper either a set of numbers, for example a double digit number such as say 43, okay, or it will be a word, okay? So I can be covering over one of your ears, whispering into the other. Once I've finished whispering, I'll look at you and I want you to repeat whatever it was I whispered in the ear, okay? So either a double digit number or a word. Okay, here we go. Covering over your right side. 85. Good. 62. Good. 91. Good. 38. Okay, that's wonderful. Bridge. Good. Water. Wonderful. People. Good. Houses. Right, no problems there. Yeah, excellent. Okay, so continuing on with the cranial nerve root. I'm going to be using a tuning fork here. Okay, so a quick, what we like to call the Renee and Weber test. Okay, it's nice and simple, nothing to worry about. Okay, so I'll be placing this on the bony part behind your ear, which we like to call a mastoid bone. Okay, just a little bit there that protrudes outwards. There'll be no pain involved whatsoever. Okay, so what I want you to tell me is when the sound starts and when it stops. Okay, so this is the sound we're listening for. When it starts, I want you to say now. Okay, and when it stops, I want you to say now. Okay, so it's nice and simple. When it starts, say now. When it stops, say now. Here we go. Behind the ear, like so. Okay, is that comfortable? Okay. Good. Alright, same on the other side. We'll do this twice on each side, okay? Hold up. Alright. Same again. Good. And one more time. Okay, wonderful. Quick note here. Okay, so it's a normal response, that's fine. And I'm going to be checking the centre of the forehead, okay? So I'll be placing this here. I want you to tell me when it starts and when it stops, okay? There we go. Yep, looking at my nose. Okay, we'll do that again, so looking at my nose. One more time. Tell me when it starts, when it stops, okay? Okay, well done. Now, did it sound the same roughly on one side to the other? Okay, I'll do that again just to make sure, okay? So let me know if it sounds more or less the same on each side, okay? More or less the same, yeah. Okay, that's good. Alright, we're making very good time here. We're doing everything perfectly, okay? So there's absolutely nothing to worry about. There's nothing I've seen that would cause me any concern whatsoever, okay? So just keep nice and relaxed. You're doing excellently. Okay, so that was the cranial nerve 8, that's fine. We're going to move on to cranial nerve 7 now, okay? So we're going to do some facial expressions. Alright, so I want you to raise your eyebrows for me. Okay, and relax for me, please. And I want you to close your eyes and don't let me open them, okay? So closing your eyes, resist, resist, resist. And relax, well done, open your eyes. Good. Okay, if you can puff out your cheeks and don't let me squeeze them in. That's it, don't let me squeeze them. And relax, well done. Okay, that's that done. Okay, if you could purse your lips. Okay, again. Okay, it's wonderful. And give me a big teethy grin. Okay, it's fantastic. And relax. Any changes in taste at all recently? Okay. Have you noticed that your hearing sounds any different? Okay, that's fine. About the same. Alright. So just to finish off this particular cranial nerve, I will just be inspecting physically your ears. Is that okay? Alright, so I'm feeling around, okay? So just look forward for me, that's wonderful, thank you. Just pulling and putting on any part of the ear, and really we're looking for any reddening or any pain sensations. So if you do feel any pain, do let me know. Okay. And was it okay? Wasn't any pain? Okay, we'll do exactly the same on the other side, alright? So you did very well, so well done. Okay, just looking around the back of the ear, bottom, everywhere you can possibly look. Folding, prodding and pulling and squeezing different parts of the ear. Okay, there we go. Any pain at all? Okay, that's fine. That's absolutely fine. Okay. We're going to be doing the trigeminal nerve now, okay? Cranial nerve number 5, and that's all to do with sensations. Okay, first of all, I just want to get my rather intimidating looking reflex hammer, okay? Can we place this, well, first of all, we're placing my finger on your chin, like so. Okay, I'm going to be giving my finger, not your jaw, but my finger a whack with the hammer, okay? So keep it nice and relaxed for me. Okay, that's great. I'm going to do it one more time. Okay, that's wonderful. So, yeah, just checking the jaw reflex there, okay? But everything's fine, so no need to worry there. You've done that excellently. Okay, that's that one done. Alright, we're going to move over to the fine sensation here, and then move on to the pinprick sensation in a moment. Okay, so the fine sensation is just a Q-tip or cotton wool bud, and I'm just going to first of all press this, or gently brush this around, or brush your face, sorry, and I'll just give you an idea of what the sensation is going to be like. Okay, so there it is, nice and soft. That's the feeling we're looking for. Going to be brushing it on 6 locations, covering 3 cranial nerves. Okay, so I want you to tell me if you can feel it. Simple as that. Okay, so let me know if you can feel it. Good. Good. Well done. Same on the other side. Good. Excellent. Okay, now I have to ask, you felt everything fine, that's great, but did it feel the same roughly on both sides of the face? Good. Okay, so that was the fine touch sensation. Pinprick now, exactly the same, albeit slightly sharper object. In this case it's a pair of tweezers. It is a little bit sharper, but it, you know, I will not break the skin or anything like that. Don't worry. Okay, I'm going to give you, first of all, I'm going to brush this across your skin so you know what the sensation feels like. Okay, so here we go. That's all it is. Yep, doesn't hurt a bit, does it? Okay, so again, these 6 strategic points. Let me know if you can feel it. All right, here we go. Good. Good. Excellent. Well done. Good. And good. Now you know what I'm going to ask you now, don't you? Yeah. Was it the same on roughly on both sides? Did it feel the same? So that was the trigeminal nerve sorted. We're going to do the cranial nerves 3, 4, and 6. Okay. So we're going to be doing this. We're going to follow the finger test. I think it's the best way forward for this one. First of all, I need to ask you, have you experienced any double vision at all? Okay. So now, I'm going to be moving my fingers like so, up and down, left and right. I want you to look at the very tips of them, using your eyes only, so keeping your head straight. Okay, so don't move your head, just moving your eyes. Okay, so look at me with your face aligned with mine, but moving your eyes only. Track the tips of my fingers. There we go. Keep tracking the tips of the fingers. Good. Good. Doing well. Excellent. Okay, well done. Keep going. Good. Good. Okay, and relax. We're going to be doing the same on the other side this time. Okay, so give yourself a second, blink a few times. Alright, so same on the other side. Following tips of the fingers, keeping your face aligned with mine. Only moving the eyes, tracking the tips of the fingers. Good. Okay, keep going, you're doing very well, okay? Tracking very well with both eyes, no difficulties observed. Good. Okay, slowing it down a little bit. Good. Good. And there we go, relax. Okay, good. Was there any double vision, by the way, when we performed that test? Okay, good. Okay, that's that then. Alright, so we're going to go over to the optic nerve, okay, cranial nerve number 2. And we're going to do a range of different tests for this one, so it's quite in depth, okay. So I think, I think we'll start with a fundoscopy first, okay. Just to get this one out of the way with, because it is a little bit of a pain. Alright, so I've got some eye drops here. These are Mydriatic eye drops, and these will dilute your pupils, okay. So just ever so slightly, if you can just put your chin up a tiny bit for me. Oh, sorry, I did miss that. There we go, on the other eye. There we go, okay, that's great. So yeah, just blink a few times to get the eye drops well incorporated into each eye. That's fantastic. Okay, so no pain observed. Okay, I'll make a note of that. Okay, so I'm going to be using my filmoscope here. Okay, I'm going to assess the optic disc and the vessels on the back of the eye. Okay, so first of all I need to dim the lights, alright, so give me a second. Okay, so we have a very bright light here. I'll be shining the light in both eyes for approximately 2 seconds, okay? So I'm going to be shining into your left eye, a bright light in 3, 2, 1, and done, and into your right eye in 3, 2, 1, and there we go. That's that. Okay, that's not the end of it though. There will be more lights shining into your eyes. Okay, so that was all very good indeed. Okay, so that was the back of the eye. We're going to be checking the surface in just a moment, okay? Okay, so I've got to adjust my setting here. So I'm getting the magnifying glass. So we're checking the surface of the eye. So in the left eye in 3, 2, 1, and done. And in the right eye 3, 2, 1, and we're done, okay? Well done, nearly there. One more time. I have to check the red eye reflex. Okay, so we're looking for the reflection on sort of a reddish orange reflection of the pupil, okay? So once again, shining the bright light into your left eye in 3, 2, 1, now, and we're done, and into your right eye in 3, 2, 1, and there we go, we're done. Alright, well done. I can appreciate that is, yeah, it's a little bit uncomfortable. I do understand, that's why I like to be as quick as I possibly can, but that's is the so-called fundoscopy over with, although it's not much fun, is it? Alright, so, quick visual field check, okay? I want you to close over your left eye, I'll be closing my right, okay? And I want you to look into my left eye, okay? I'm going to be bringing the fingers into your field of vision from all 4 corners, and I'm going to be wiggling them. I want you to tell me when you can see them, okay? So closing over the left eye. Okay, let me know when you can see my fingers. Good. 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 Okay, now we're going to do exactly the same on the other side. So you close over your right, I'll close my left, and again let me know when you can see my fingers. Good. 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 Okay, well done there, relax. That's another one done that's a bit tricky. Okay, so that's visual fields, everything is fine, okay, all four corners, very acceptable indeed, alright. Okay, so we can do the accommodation reflex, okay, which is the constriction and convergence. So I want you to just quite simply look at the wall behind me. Any spot you choose is fine. Okay, just keep looking at a spot behind me. Okay, now I want you to look at the pen light. Okay, that's great. Now pick another spot behind me. Keep looking at that. And now I want you to look at the pen light. That's great. Now pick another spot behind me. Take a step forward here. So if you have to readjust your spot, do so now. Keep looking at the spot. Okay, now look at the pen light. Okay, well done. We are nearly there, okay? You are doing incredibly well. You should be very proud of yourself, alright? We're getting there. Okay. So I'm going to do a swinging light test here. So I'll be swinging the light from one eye to the other, okay? So I want you to look forward, please. Good. 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 And good. Well done. No problems there, so excellent. Okay, so it's the pupillary reflex time, alright, which sounds very complicated, but it is rather simple, I can assure you. Okay, so I'm just debating whether I need to turn the lights down or not. Let's see. Yeah, I think we'll turn off one of the lights here just to slightly dim the room. We don't need to go too dim. I think that should be enough. Okay. So now I'm going to be placing my hand across your nose like so, okay? Just splitting the two eyes and looking for the consensual response. Okay, so keeping still, looking forward is fine. Okay, I'm going to be looking at the consensual response. Okay, that's great. Okay, that's fantastic, well done. Good. Okay, we'll pop the light back on. Okay, so we are nearly there. Okay, I'm just going to quickly inspect the pupil size and alignment. Okay, so looking forward is fine. Okay. Have you experienced any changes in smell recently? Okay. Right, and just to finish then, we're going to use this little chart here. Eye chart if you prefer. Okay. I want you to close over your left side, or left eye rather, to start with. Okay, and I want you to read the letter as soon as I point to it. If you're not quite sure what it is, I will accept your best guess, okay? Alright, you ready? Okay. So, left eye closed, make sure you're not cheating. Okay, I trust you. Here we go. Good. Now, close over your right eye for me. Okay, I want you to read the same two lines backwards. Here we go. Okay, take quick notes and you'll be free to go, okay? So you've done absolutely fantastic across the board. No issues whatsoever. Everything's passed with flying colours and you've done very, very well indeed. So it was an absolute pleasure to test you today, and I hope you have a very nice rest of your day. Okay, well, take care.